Everybody's ready?
Yeah.
Okay. Okay, I'm gonna share the document here. Is it visual? Can you see?
Yes.
Okay. Kamalpreet, you are talking, but you are muted.
Do you started your recording?
Yeah, we can do that. Mm-mm. Okay. Oh, shit. Good morning, Professor, and good morning, my colleagues. My name is Ranjita, and I'm one of the team members from Group 10. And so, today, my team and I will present our executive leadership consulting analysis on the topic of Maple Healthcare Network. So, starting our presentation, here is the little overview about our presentation agenda for today. So, here is what we will cover. We'll start with executive summary, then we will walk through the Maple Care's background, followed by detailed situation analysis covering workforce, the operations, finance, and ethics. From there, we'll dive into our leadership analysis, present 5 strategic recommendations, outline and implementation plans with clear KPIs, and close with the risks and our conclusion. So here is our executive summary. Maple Healthcare is under pressure on the multiple fronts. For instance, workforce shortage, rising cost, growing patient demand, and cultural strengths. But here is our key finding: these challenges aren't just operational. At the core, this is leadership, communication, and cultural problems. So fixing the operational alone problems alone won't solve it. Maple Care Health Network needs a fundamentally different leadership response. Moving on, the introduction and the context here. So this isn't unique to Maple Healthcare only. It reflects a province whole-wide crisis. So across Ontario, demand for care is rising as the population ages, staff levels are critically low, uh, and the budget are tight, even cost climbs. At the same time, technology is evolving fast and burnout is widespread. Healthcare leaders today have to balance the patient safety, well-being, staff well-being, and financial sustainability and innovations, often at all at once with no easy trade-off. So why Maple Care needs this assessment? So here is the paradox. Maple Healthcare is clinically very strong. It has an excellent care record. He has adopted the digital health tools and also has the solid long-term strategy in sustainable care 2030. But underneath that, there are serious cracks: persistent staff shortage, declining engagement, breakdown in communication, and eroding trust in leadership. Frontline staff felt excluded from decision making, and the middle managers are stuck between the executive priorities and floor level realities. So, moving on, the scope of analysis here. Um, so, to address this properly, our analysis uses a comprehensive framework. We will look at the planning, organizing, leading, and controlling, which is overall POLC model. So, along with the personality and leadership styles, different leadership approaches and values based leadership are being also used here. So we'll also examine communication, decision making. Uh, Together, this gives a full multi-dimensional view of the effectiveness at Maple Care Health. So moving forward, I would like to hand over to my colleague to further presentation. Thank you.
Thank you, Ranjita, and good morning, everyone. We have just reviewed the executive summary, so now let's understand the broader context in which MapleCare operates. So now let's understand the scale of MapleCare. It was founded in 1999 as a group of hospitals coordinating care in Eastern Greater Toronto area. MapleCare has grown into one of Ontario's largest integrated healthcare systems. It serves a population of 2.3 million people. That's one of the largest catchment areas in the province. The organization employs over 11,500 people: physicians, nurses, administrators, researchers, and support staff, all working across more than 30 facilities. This includes 4 acute hospitals, 2 rehabilitation centers, 12 clinics, 8 urgent care centers, 3 long term care homes, and a cancer center and a virtual care services. Maple Care operates with an annual budget exceeding 2.8 billion and has grown continuously over 25 plus years through mergers, acquisitions, and strategic partnerships. This is not a small community hospital, this is a massive complex healthcare system with enormous reach and responsibility. Next slide, please. So, now let's talk about the current environment. The post COVID world has drastically changed operational realities. We are seeing population growth, aging demographics, and increasingly complex patient demands driving more admissions. Patients are staying longer and requiring more intensive care, while waits for long term care and community based service continues to grow. In response to these pressures, Maple Care launched Sustainable Care 2030, a 5-year priority transformation strategy designed to address workforce sustainability, digital transformation, patient access and flow, financial stability, innovation in care delivery. It's a forward looking, comprehensive vision. It acknowledges that the current model is unsustainable and charts a path forward. But here is the challenge we have identified. A strategic vision, no matter how well designed, is only as good as people who implement it. And that brings us to emerging leadership challenge. So next slide please. So this is where the real problem lies. Despite the ambitious Sustainable Care 2030 strategy, engagement surveys show that confidence in senior leadership is declining. Transparency of communication is a growing concern. Frustration with decision making process is increasing. Frontline employees feel that they are not being listened to. They see decisions being made about their work without their input. Middle managers feel trapped, caught between executive priorities and harsh realities on the hospital floor. Most concerning, staff perceive sustainable care not as improvement but as an additional burden, another set of demands on an already exhausted workforce. This is creating resistance and eroding trust, which are eating into organization cohesion. And without trust, without teamwork, and without genuine employee focus, transformation will fail. So, the key finding from our analysis is this: the core issue at the Maple Care is not operational, it is a leadership, communication, and a culture challenge that requires a fundamentally different response. The problems of staffing, capacity, and finances are symptoms, not disease. With that foundation laid, let's move into a detailed situational analysis to understand exactly how these challenges are manifested on the ground. Thank you. Now I would like to hand it over to my colleague.
Thank you, Vidit. We just viewed the organization background. Now we will go through the situational analysis. So now I will present our situational analysis of Maple Healthcare Network. We identified several interconnected leadership challenges that affect the organization performances. These include the workforce shortages, operational pressure, and financial constraints and ethical decision making. Moreover, communication gap, technological transformation, and the managing multiple stakeholder expectations. I will briefly explain each of these challenges. So the first challenge is a workforce sustainability. Maple Care is experiencing a serious shortage of healthcare professionals. Around 32% of employees are expected to retire within the next 7 years, which means the organization will lose a significant amount of experience and the knowledge. At the same time, nursing vacancies remain above the 20%, forcing nurses to for the 6 to 7 of the or more patients, which exceed the safe staffing level. This results in the burnout, declining employees' engagement, and the increased turnover. These findings shows that the organization needs to be focused not on the recruitment but on the retaining its existing workforce. Next slide, please. So workforce shortages have created a major operational challenges. Emergency department are operating above capacity, resulting in a long wait times and the overcrowding. Some patients are treated in the hallway because of hospital beds are unavailable. Surgical trays, mental health services demands, and the limited long-term care bed further increase the pressure on the healthcare system. These issues demonstrated how shortage in one area quickly affect the entire organization. Next slide, please. These staffing problems also create the significant financial challenges. Spending on agency nurses has increased dramatically, which over time cost is continue to rise each year. If these trends continue, the organization will face larger operating defects. This creates a viscous cycle where the staffing shortage increase costs and the higher cost make it more difficult to recruit and retain employees. Therefore, financial sustainability depends on solving workforce challenges. Next slide, please. Healthcare leaders also face a complex ethical challenges. They must decide how to allocate limited resources such as ICU beds and the staffing while ensuring patient safety and the quality care. Another challenge is balancing employees' well-being with the increasing patient demand. The introduction of artificial intelligence also raises the questions about the accountability and the professional responsibility. Ethical leaders must make a fair, transparent, and the patient-centered decision while supporting their employees. Next slide, please. Another important issue is the communication. Many frontline employees feel that senior leadership does not fully understand the challenges they face every day. Frequent policy changes and the information overload often reduce the trust and the employee engagement. Leaders need to be communicate more openly, involve staff in a decision making, and they create opportunity for the two-way communication. Building trust is essential for successful organization challenges change. Next slide, please. Maple Care is implement technological such as electronic health records, virtual care, predictive staffing, and artificial intelligence to improve the healthcare delivery. While these technologies can increase the efficiencies, many employees are concerned about the additional workload, loss of professional autonomy, and the accountability for AI-assisted decisions. Leaders should provide proper training, involve employees in early in the implementation process, and they clearly communicate how technology will support rather than replacing healthcare professions. Next slide, please. Finally, Maple Health must balance the need for the several stakeholder groups. Employees expect safe training, fair compensation, and the leadership support. Patients and the families want timely and high quality and the compensated care. Government agencies focus on the accountability and the financial sustainability, while union advocate for the better working conditions. Effective leadership means balancing these different priorities to achieve both organization success and the better patient outcome. So, in conclusion, these challenges are interconnected and addressing them requires strong leadership and effective communication and the long-term workforce planning. Now, I will pass to the Reshma for the other.
Thank you, Kamalpreet. Good morning, everyone. So in this section, we will assess how the MapleCare leadership is performing, looking closely at the executive team driving the sustainable care and identifying what needs to change for that vision to succeed. So the next slide is planning and organizing. Planning is strong. Leadership proactively recognize the model is unsustainable, and sustainable care is comprehensive, but it lacks the inclusion. Staff feel exhausted, and burnout wasn't addressed. Organizing shows the same gap. Restructuring happened without true partnership, and the department remain understaffed. And the next slide is leading and controlling. Leading is the weakest area. Confidence in leadership is low. Staff feel exhausted from decision, and the why behind the reason isn't communicated. Controlling is mixed. Matrices are tracked widely, but target feel unattainable, and there is no measures of staff well-being. And the next one is executive leadership profile. Three executive lead this effort. Dr. Morrison, CEO, is a visionary but seen as disconnected from the front line. Mark Delaney, CFO, is financially sharp but seen as a budget first. Angela Russo, Chief Nursing Executive, champion staff well-being but is seen as underweighting finances. Each brings a strength and a blind spot. And the next is personality and emotional intelligence. Morrison is high in openness, driving the innovations. Delaney is high in conscientiousness, driving the discipline. Russo is high in agreeableness and empathy. All three lead well publicly, but trust across the team is low, and their different style create real conflict. Competence alone isn't enough. And the next one is leadership approaches assessment. No single style fits here. The transformational vision needs trust to land. Transactional discipline keeps the things stable but won't rebuild the morale alone. Adaptive leadership fits the MapleCare's complexity best. And the situational leadership is needed day to day since different staff needs the different support. And the next one is value-based leadership work. Value-based leadership is foundational here. Ethical transparency is tough decision. Servant leadership like Russo's focus on staff well-being. Authentic honesty about the pressures and inclusive real consultations, not the tokenism. Together, these rebuild the trust. And the next is communication and decision-making effectiveness. This is MapleCare's weakest area overall. Communication must become two-way, not just the broadcast and tailored to each audience. Decision need the real consultation and evidence. Ultimately, trust is the foundations. Without it, staff won't commit to change. So in short, MapleCare has a sound vision and capable team, but low trust and weak communications are holding it back. In the next section, we will build on this diagnosis and turn to our specific recommendation for how the MapleCare leadership can close this gap. So that's my sections. I will hand it over to our group member Rupa Regmi. Thank you.
Thank you, Resma. So let's talk about the strategic recommendations. So now let's get into what we think about the MapleCare should actually do. So we have 5 recommendations. So the first 2 are about people, the workforce, and the leadership. The last 3 are about how the organization runs day to day, trust, technology, and culture. Next slide, please. So the first recommendations are workforce sustainability and strategy. So this is our top recommendations: make workforce sustainable and MapleCare number 1 priority. So that means better recruitment, partnerships with school, stronger retention for current staff, flexible scheduling, and the better mentorship and real mental health support. So the payoff is that the less turnover, better engagement, and a lot of less spend on overtime and agency staff. Next slide, please. So the second recommendation is leadership development and succession. So we recommend building the real leadership development at MapleCare, not a one-time workshop. So that means training is emotionally intelligence, communications, and change leadership plus coaching and succession planning for a key role. This build the stronger leaders and help to rebuild the staff trust over time. Next slide, please. So the third recommendation is the trust, communication, and renewable strategy. So trust and communications, this is one of the everything else depends upon this, and we are proposing real monthly town halls, leadership roundings, and employee advisory councils, and also the honest regular updates. So including the hard news, not just a good news. So the goal is not more communications; it's the communications people actually believe. So the fourth one is the fourth recommendation. Slide change, please. So, the technological governance staffs are anxious about how AI is better rolled out. So, we recommend an AI ethics commit, clear accountability policies, mandatory human oversight on clinical decisions, and real staff training. So, with frontline input from the start, no after the fact. So, this build trust in the tool, which is what makes adoptions actually work. The fifth one is the culture and the well-being. This ties everything together: psychological safety, recognitions, better work-life balance, share governance, and real follow-through the engagement survey. So, so bottom line is that none of this works without peoples, and that is where the Maple need to invest. So now rest will be explained by my friend. Thank you.
Hello. Now I will explain our implementation plan. Next slide, please. To make this recommendation successful, MapleCare should follow phased approach rather than trying to change everything at once. In short term, within the 12 months, the organization should focus on employee wellness programs, leadership communication training, executive town hall meetings, employee advisory council, and creating an AI governance committee. These actions will rebuild trust and improve communications. In medium term, between 1 and 3 years, MapleCare should establish leadership academy, strengthen recruitment partnership with college and universities, introduce flexible work arrangement, and expand mentoring programs. Finally, in long term, from 3 to 5 years, the organization should fully implement the sustainable care of 20 2030 strategy. Expand AI and digital healthcare solution and strengthen succession planning to ensure long-term workforce sustainability. Next slide, please. So the key performance indicator. To evaluate whether this strategy are working, MapleCare must continuously monitor key performance indicators. For workforce performance, yeah, important indicators includes employee turnover, vacancy rates, overtime hours, and employee engagement scores. For patient care, MapleCare should measure patient satisfaction, emergency department wait times, quality of care, and patient safety outcomes. Leadership success can be measured through employee trust surveys, communication effectiveness, and participation in leadership development program. Finally, financial indicators such as agency staffing, cost, overtime expense, and budget performance will help determine the organization is becoming more financial sustainable. Next slide, please. So, risk, challenges, and conclusion. Next slide, please. Although this recommendation provide a clear roadmap, there are several challenges that MapleCare must overcome. The first challenge is resistance to change. Many employees have already experienced significant workplace stress, so they may hesitate to Accept additional changes, leader must involve employees in decision making and communicate openly throughout the process. The second challenge is financial limitation budget. Budget constraint may slow implementation, so MapleCare should prioritize initiatives that provide the greatest long-term value or return on investment. Another major challenge is continuing healthcare workforce shortage across Ontario. Recruitment alone will not solve the problem, so retaining experienced employee must remain at a top priority. Finally, adopting AI and digital technologies may create concerns about professional autonomy and patient safety. Continuous training, strong governance, and active involvement of frontline staff will reduce risk and improve acceptance. Next slide, please. So the conclusion. In conclusion, MapleCare is facing one of the most significant leadership and workforce challenges in its history. Our analysis shows that these issues are closely connected. Workforce shortages, communication problems, declining trust, financial pressures, and technology adoption cannot be solved separately. While Sustainable Care 2030 provides the right strategic direction, its success depends on effective leadership and employee engagement. Our five recommendations focus on strengthening workforce sustainability, developing future leaders, and rebuilding trust through better communication, implicating ethical AI governments, and creating a healthier organization culture. By adopting adaptive, transformational, and values-based leadership, MapleCare can improve employee satisfaction, strengthen patient care, to long-term financial sustainability. Next slide, please. Thank you.